So the journey started there where I had to figure out what was this transformation? Where was I gonna go? And you gotta keep on looking for things and learning. I learned that long hours weren't worth it. Burning myself out wasn't worth it. And I felt that I am the better doctor now. I am the best doctor in all the years I've been because I'm actually there with my patients more. I'm awake. I am not burnt out. I am not tired. I used to deliver babies all night long and then see patients all day long. Now I'm at home in my bed at night, sleeping, and I'm so much more with it in the morning talking to the patients. So it's just such a change. You can't just run like a hamster. I literally just felt I was running. And it's about healing yourself, making yourself and your patients the best. And you've got to evolve because things are just keep changing. If anybody's still taking insurance out there, you know, there's a 2.9% Medicare rate this year cut. And, you know, the insurances are just cutting. And again, the answer is always like, we'll see more patients. It just doesn't add up. So my moment of reckoning was I was sitting in the audience right here, right like you guys, in Charlotte in 2018. And I was sitting there again thinking I knew vaginas and hormones. So I was thinking, okay, I'm gonna get the woman's wellness. Well, my husband was sitting in the audience too, and he's like, well, you got an optimist too. I'm like, an optimist, I know women's wellness. He goes, well, we're gonna do laser hair removal, Lumecca, and faces. And I was like, well, how are we gonna do all that? He's like, you're gonna learn. He's like, you're a provider. You went to med school. You can learn this. If you want to, you can learn to do anything. All of you guys are here today for a reason. You all care about your practices. You all care about your patients. You all want a better life too for yourselves and a better practice and have the best you can offer. So you can learn to do these things. So as I sat in the audience, I was inspired by Dr. Mulholland that was giving the talk that day. And I went up to him afterwards and I'm like, can we really do this? Can we open a med spa? You know, like, and he looked me in the face and he goes, you can do it. And it was like that little kick I needed, just that little push, because everybody has to take that leap of faith to move forward. So we bought the Votiva at the time. If Empower would have been out, that would have been the one I would have gotten because there was so much on that platform. But Votiva was the women's wellness at that time. So we bought the Votiva and the Optimist. And I was surprised. I was like, well, who's gonna come to a gynecologist to get their face done? The very first patients, as soon as we were talking about how it worked, collagen and elastin, the first question was, can you do my face too? And I was like, yes, we can. And next thing you know, we're doing faces just as much as vaginas.